Today on Cancer Buzz, an award-winning program to identify and screen patients at risk for pancreatic cancer. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the fourth episode in our six-part series on the 2024 ACCC Innovator Award winners. For 14 years, ACCC has used the Innovator Awards to highlight unique solutions in cancer care and give other cancer centers across the country a chance to recreate the programs. You can engage directly with the award winners at the ACCC National Oncology Conference this fall. Today's guest joins us to share the award titled A Sustainable Model for Improved Quality for Pancreatic Cyst Surveillance and Early Pancreatic Cancer Detection. Dr. Russell Langan is the Director of Surgical Oncology for the Northern Region of RWJ-Barnabas Health at Kuberman-Barnabas Medical Center in Livingston, New Jersey.
There remains a knowledge gap in this country with respect to the risk associated with pancreatic cysts. There are many patients that are identified to have a pancreatic cyst on an incidental scan, and then we'll see their primary care physician or a gastroenterologist and are told that there's no risk there. And a certain amount of patients will then return years later with a pancreas cancer. And it's very unfortunate when we see that as pancreatic surgeons, because we know that that risk, that cancer could have been addressed when it was just in its precancerous state, when it was just a risk for the patient, not a invasive pancreas cancer that would threaten their life. And that knowledge gap remains. So one of the main points I really want to make sure we address is that we are trying to close that knowledge gap and inform practitioners in this country about risk associated with pancreatic cysts.
What are some of the specific challenges with pancreatic cancer that cancer care teams face that led to your program?
There are numerous pancreatic centers in this country and internationally that have pancreatic cyst programs. Having a pancreatic cyst program is not, albeit novel, but there are many challenges associated with those programs. One is that most programs require a significant amount of human bandwidth to run a program, to manage the Excel spreadsheets or online databases. There's also difficulty in ensuring that patients who are in your program who have risk are following up with the appropriate scans, the appropriate endoscopic procedures, and follow-up. So really there are quality problems with running surveillance programs, and there are medical legal issues with running surveillance programs. So we really found that when onboarding an artificial intelligence software, we were able to mitigate medical legal risk, and we're also able to increase the quality of the identification of the patient who's at risk and then the longitudinal surveillance for that patient.
What does the future look like for pancreatic surveillance?
A goal of ours is to create a national registry in partnership with our national society, the America's Hepatopancreatobiliary Association, to really have the nation's largest pancreatic cyst registry and database so that we can better study this population and perform predictive analytics of this population to try to improve the quality further down the road for a patient population who's living at risk for the development of pancreatic cancer.
What do you think is the benefit for attending the National Oncology Conference?
Although, our society has moved to really adopting significant amount of online or virtual interaction or online or virtual learning, there are still tangible benefits to in-person knowledge gain. And I truly believe that part of that tangible benefit are the discussions that can occur during session or discussions immediately after session to collaborate with the other members and attendants and those giving a presentation that does not translate well into the virtual space.
Dr. Langan will present this program on early cancer detection in greater detail at the ACCC 41st National Oncology Conference, which will be held October 9th through the 11th in Minneapolis. You can find a link to register in the show notes. Make sure to listen to the rest of this Cancer Buzz series and learn about the other Innovator Award-winning programs. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.